Good morning. This is David Henry. I'm the Communications Manager for the City of Amarillo. I want to welcome everyone to this week's news conference for the latest in COVID-19 information for the Amarillo community. Once again, we do these every Wednesday at 11 a.m. Let me go ahead and introduce who is on our panel today. We are joined by Amarillo Mayor Ginger Nelson, Amarillo Fire Department Chief Jason Mays, Casie Stoughton, Public Health Director for the City of Amarillo, Dr. Scott Milton, Public Health Authority for City of Amarillo, Texas Tech University Health Sciences Center, Dr. Brian Weis, Chief Medical Officer for Northwest Texas Hospital, Dr. Michael Lamanteer, Chief Medical Officer for BSA, Dr. Rodney Gonzalez, Director of the Amarillo VA, and City Manager Jared Miller. What we'll do is we'll open it up to our panel to make some brief statements, and then we'll take questions from our media. We'll go ahead and start today with Amarillo Mayor Ginger Nelson. Mayor, how are you?
I'm well, Dave. Thank you very much. You're seeing that our panel is wearing masks. I'm here by myself, so I'm going to take mine off so that you can hear me better. But we want to encourage you as a citizen to do this simple thing: wear a mask. You're not wearing it for yourself. You're actually wearing it for those that are around you. But it's being shown statistically, the cities and communities that have the lowest COVID rate, including COVID hospitalizations, are cities that are wearing masks. So I'm asking you as a citizen to make that your priority. Lots of challenges in our city. While we're fighting COVID, we've also been in the midst of a very historic and divisive election season. So congratulations. Today is November 4th, and you are now on the other side of what's been one of the most challenging elections in our nation's history. But I want to thank each and every one of you who voted and participated in our wonderful system of democracy. We had a record turnout here in the city of Amarillo, and I'm very, very proud of that, especially if you were a first-time voter. Thank you. Thank you for being involved. I'm disappointed with the result of our Proposition A, but it doesn't change the fact that a majority of you felt that now was not the right time to do that. And I recognize that that project was a big reach, and it was a big reach that happened to coincide with a difficult season of uncertainty in our city. So we heard you, and I still want to say thank you. Thank you for letting us ask. But now I want to ask that you would join with us as we all come back to doing life in the city of Amarillo post-election the best way that we know how to do it, and that is working together. So I look forward to leading in this season with hope, and I would ask that you as a citizen would approach your choices and your opportunities to lead in the city the same way, with hope, because hope leads better than fear every single time. That's all I have this morning, Dave. Thank you.
Thank you, Mayor. We're now joined today by Jason Mays, Chief of the Amarillo Fire Department. Jason, we're glad to have you today. How are you?
You're doing well. I appreciate the opportunity to be here. And like the mayor, I too will remove my mask since I'm in my office alone. Some disturbing things, and I haven't had the opportunity to really address anyone in our community on this area about the impact that we're seeing due to COVID. Some of the recent numbers are over 700 healthcare workers coming to our area in the Panhandle and the South Plains region. And I've heard numbers of upwards of 1,000. And I just wondered myself, as a leading a first responder organization, where does it end for our area? So in this, we've heard, resistance. We've seen this politicized like no other recent thing on the federal and the national level to our local level even. Our fierce independence as Amarilloans and everyone else in the Panhandle region, we don't like being told what to do, and we want to make a stand for what we believe is right. But what we're seeing here is we have a lot at stake. It's our friends and families that work for hospitals. It's our friends and families that were related to while there's so many people that if they are exposed and do come down and contract COVID, odds are they're going to bounce back, but we'll all have somebody that we're related to and we love and care about that will not fare well with this. We have small businesses and the impact that that does to our local revenues to take care of our city the way that you've come to expect. And what we're seeing here recently is really drastically impacting public safety. For instance, what we're seeing now is a disturbing trend we have fewer and fewer ambulances available. And the reason why is they're backed up at the ER. An ambulance transports someone to one of our hospitals and they can't remove the patient quick enough. They're scrambling to find rooms, from what I understand. And we find ourselves in a state of called status zero. And that basically means there's no ambulance. So while we're waiting, and usually we will dispatch and have a fire truck sitting at home, basically reassuring the patient, because we do not have transport capabilities on a fire truck. And meanwhile, if a fire breaks out down the street, or we have a severe car accident, that truck is tied up. So what we're asking is that all the precautions that have been out there, just embrace that. Wear your mask, wash your hands, social distancing, those things work. Mom was right, wash your hands. No one of those factors alone can prevent this, but everything together combines and then puts us in a state where we can be safer. And the way I look at it too, we've had a lot of instances of members of AFD exposed to COVID, either have tested positive or been quarantined. And simply put, if we can't come to work, we can't put people on fire trucks, we can't respond to your medical calls, we can't respond to your car wrecks, we can't respond with the force that we need to extinguish your house fire. So please help us help you and embrace these precautions, and let's just own this, and let's clean up our own mess here in Amarillo. Thank you.
Thank you, Jason. Let's now go to Casie Stoughton, Public Health Director for the City of Amarillo. Casie, how are you?
I'm well, Dave. Thank you. I'm glad to be here this morning and to visit with everyone in our community. This Wednesday looks a lot different than last Wednesday, and so it's nice that there's not snow out on the roads. So it is good to be here this morning. As of yesterday, our total case counts for COVID-19 were up to 4,978 total cases of COVID-19 reported in Potter and Randall counties. 8,766 cases are reported in Potter County and 6,212 cases in Randall County. We have a total of 10,367 recoveries, and we're thrilled with each and every one of those recoveries. And we're sad to report 166 deaths related to COVID-19 here in our community. That leaves us with 4,445 active cases. Each of the cases do represent a unique individual. The rolling 7-day positivity average for Potter and Randall counties is up to 24%. And the positivity rate at the drive-through testing site is up to 48%. That means that nearly half of the people tested at the drive-through testing site test positive. The 5-day new case average is up to 379 new cases per day. That's a lot of new cases. And I appreciate Chief Mays and Mayor Nelson and their encouragement for us to reduce those new cases each day by the prevention measures that we've talked about. Our community does remain at status level red. Conditions remain consistent with those measures that put us at status level red. Indicators are all over the status level red threshold. We'll evaluate next week and either reissue another status level red for 2 additional weeks or move to level orange depending on what those metrics indicate. The public health drive-through test site does remain operational, and you can call 378-6300 to be screened and directed to the test site. Day before yesterday, our team tested a record 200 patients at the test site. So we certainly appreciate the work that they're doing out at the test site. GA32's hospitalization rate for the 25 county Panhandle RAC region has been at over 15% for 18 consecutive days now. Yesterday's RAC hospitalization percentage was 31.01%, meaning that 31% of all hospitalized patients have COVID-19. That is just a startling number. Wearing a mask, staying at least 6 feet from others, staying home if you're sick, and if you are positive for COVID-19, that means a minimum of 10 days from the date that you tested positive. And staying home if you've been exposed to someone with COVID-19. And if you've been exposed, that means staying home for at least 14 days from the last time that you saw the person who was positive. Those prevention measures are all so critical in the slow of COVID-19 here in our community. We've got to ease hospital capacity. We've got to ease the burden on our healthcare workers so that they can help us, care for us, like Chief May said, respond to our car accidents and our house fires, all of the things that we've come to rely on here in Amarillo. So with the holidays right around the corner, we've got to pull together as a community, making wise decisions about gatherings, group gatherings, who we're going to meet with and what we're going to do, if we're going to wear masks or not. Those are all decisions that we have to make wisely. And if you're going to be wise, you've got to wear a mask. We've got to do that to make a difference with active cases, with COVID cases, and especially with COVID deaths here in our community. And that's all I have today, Dave.
Thank you, Casie. We'll now go to Dr. Scott Milton, Public Health Authority, Texas Tech University. Dr. Milton, how are you?
I'm good. Thank you, Dave. Just a brief statement. The continuing rise in our active cases translates eventually to increasing hospitalization use. And this trend continues. Clearly, the pandemic is far from over, and I expect to see more strain on our hospitals over the coming weeks. This will be a holiday season like no other. So as we've all repeated previously, please wear a mask. Avoid crowds and gatherings. Outdoor activities are better than indoor activities. If you're sick, isolate yourself at home and don't go out. Please wash your hands and do the best we can to protect those that are most vulnerable. That's all I have, Dave.
Thank you, Dr. Milton. Let's now go to Dr. Brian Weis, Chief Medical Officer for Northwest Texas Hospital. Dr. Weis, how are you?
Good morning, Dave. I'm fatigued, not as fatigued as all these reporters who had to cover this crazy election, and not even close to the fatigue that our nurses in the ICU and in the med-surg force are experiencing right now, who are taking care of COVID patients. And many of you saw our really heartfelt appeal by our charge nurse in the MICU, Leona, last Friday, just telling people, please do what we need to do to protect them in our community. And one of them is wear a mask and keep a distance. Now, it doesn't mean you can't be creative. Like, this wonderful mask was made for me by Glenda, who was a nurse I worked with for years at JOY, and she did a wonderful job. I want to say that, interesting, nationally, they're saying that the percent mortality for COVID is going down. And I think we're having the same experience at Northwest. It does not mean that people are not getting extremely sick. I think we're doing a better job of managing those patients using things like the Decadron, the remdesivir, and these non-invasive ventilation techniques for using. But still, people are getting very, very sick. Now, as many of you know, there's been a recent discussion as to whether or not we are over-attributing deaths to COVID-19. And I want to say I do not believe that is true. The vast majority of deaths that we are blaming on the virus are due to the overwhelming pneumonia that people get. And these people can have conditions like diabetes or heart disease, but what causes their death is the fact that they cannot breathe off a ventilator due to the damage to the lungs that this virus causes. Now, we're starting to recognize some other conditions associated with this virus which are concerning. And one of them is called myocarditis. That's a fancy term for inflammation of the heart. And one thing that we've seen now is these patients come in and we see elevations of the tests in the blood that indicate damage to the heart, just like they were having a heart attack. However, they're not having a heart attack. This is due to damage directly to the muscle of the heart from the virus. Now, it's estimated that probably 15 to 20% of people get this myocarditis. The concern right now is the literature is telling us that they're starting to see long-term scarring or damage in people's hearts from this myocarditis. And actually one expert I saw recommended that someone who has this condition should not do strenuous exercise for 3 to 6 months from the time of that myocarditis. But the bigger concern is, if there is scarring, could this lead to people having arrhythmias or even heart failure down the road from the damage induced by this virus? So we're recognizing there's other conditions that this virus causes that we may be actually under attributing deaths to it. So I think the biggest thing is now is this virus is the new kid on the block, and we have no idea the long-term consequences of this genetic wrench being thrown into the machinery of the human body. So all the more reason why we must protect ourselves from this virus. Now, in terms of our numbers at Northwest, so we have 112 positives in the hospital today. Now, that is 23% of our licensed beds. That's actually 41% of the acute patients in the hospital. So almost hitting that 50% mark. Right now, we have 39 in our intensive care unit. 20 patients with COVID are on ventilators. We're using 28 of our 41 ventilators at the present time. And we have 2 dedicated ICUs now to patients with COVID. And we actually have 3 medical surgical wards now dedicated to COVID. So 5 units totally dedicated to patients who are infected with this virus. Now, right now, we have 20% of our outpatient testing is showing positivity. Now, last week, we were consistently in the 30+ percentile. And so now we're down. I'm hoping this may be an optimistic, a good sign, but it's hard to tell if this is a trend at the present time. Right now, we are, in terms of the hospital, we are now going to double occupancy rooms for COVID patients, meaning we have 2 beds in 1 room. Yesterday, we were at 105% of our adult capacity at Northwest. So we've exceeded our normal capacity, and we're having to do things like convert these units to COVID units, and now adding beds to rooms to have double occupancy. So again, all indications of the stress the hospitals are still under in dealing with this current surge. Right now, we have 104 staff members on quarantine. That's a huge deal. And we are really totally dependent on these nursing staff that Mr. Mays brought in to talk about to staff our hospital. You cannot have 104 staff out and continue to function unless you're getting outside help like we are. In terms of remdesivir, right now we have enough to treat about another 80 patients. We have treated a total of 305 patients with remdesivir. Most of those patients getting a 5-day course. We've had to stop the remdesivir in about 15 patients due to evidence of liver injury from the drug. But that's a very small percentage of the total getting it. In terms of PPE, we have no concerns. We're doing very well in our personal protective equipment, and that is largely due to the help of PJ Lemons and the RAC, who have been incredible in supporting us and all the hospitals in this area with PPE. Now, one thing Casie brought up was that we're at day number 18, exceeding the 15% hospital occupancy with COVID. Under the governor's order, we are supposed to stop elective procedures if there's any risk of that taking away resources from patients with COVID. What this means is that we are continuing to do elective procedures, but we are going on a case-by-case review of each procedure beforehand to make sure that we can accommodate that patient without risking any resources being taken away from COVID patients. There may come a point, if this continues, where we will have to stop all elective procedures and use all our resources for patients with COVID. So in closing, I do encourage people, lastly, to protect themselves, not only with masks and distancing, but get the flu shot. Up to this point, we have not seen a flu positive test at Northwest, but we know it's coming. And the best thing we can do is prevent that co-infection of influenza and COVID-19. The best way to do that is get a flu shot to protect yourself from the flu. That's all I have for today. Thank you, Dave.
Thank you, Dr. Weis. Let's now go to Dr. Michael Lamanteer, Chief Medical Officer for BSA. Dr. Lamanteer, how are you?
I'm good, David. Good morning, everybody on the panel and the City of Amarillo. Thanks for letting me be on the call again this morning. I think the panel members prior to me today have tried to really put the framework around where we stand today in terms of our city, in terms of our region, the Panhandle, and how much stress we're under currently when it comes to the healthcare community here and how we can care for the patients in our region. What we're experiencing now is what we all feared back in the spring when we were looking at projections regarding the number of cases that we could have with exponential growth and spread of this virus among individuals in the community. And when I look back at the beginning of this week to try to see where we were exactly a month ago, we have more than tripled the number of patients in our hospital with confirmed COVID in 1 month's time. That's from the beginning of October to the beginning of November. That's not sustainable, folks, if that happens in an ongoing pace into the end of November, into the end of December, into the end of January, when we really at that point should be hitting the peak of flu season. We are nowhere near the peak of flu season based on the isolates that we're getting here at BSA, which typically is 5% of all the people we test that come back positive would be our flu season technically. We're less than 1% on flu isolates right now, which means that that other potential whirlwind, if you will, is headed our way, as it always comes, just a matter of what time of the season it's going to come, late fall, early winter, late winter, et cetera. Today at BSA, we have 161 patients hospitalized with COVID. Again, every day that I look at our numbers and that I'm having to speak to individuals about BSA status, I'm saying we're breaking a new record as far as the number of inpatients. 161 out of the 348 total patients that we have admitted. 348 inpatients at BSA is an extremely high number. There's no way historically we'd be able to manage that type of volume without significant expansion of our staffing resources, which right now, the only reason we're able to manage this number of patients is because of a substantial support from the RAC, as you heard earlier on this call, and the number of nurses that have been sent to our region to help assist us with managing this acute bolus of inpatients. Of the 161 that we have in the hospital, 38 of those are in our adult ICU. We do have a pediatric intensive care patient. We also have another patient on the pediatric unit that's non-ICU. We have furthermore additional individuals dispersed throughout the hospital on different units, including labor and delivery, including those that are headed to the OR today, those that are additional folks in the ER waiting to be admitted. Again, this is a situation where the disease is so pervasive right now that it's affecting all facets of our hospital functions. We have expanded our ICU as well as Northwest. You heard Dr. Weis mention that. And we have now are taking care of ICU level patients in our intermediate care unit, which is not initially where we take care of ICU patients historically. Those units are capable of managing and handling ICU patients. But again, we have had to make significant modifications when it comes to monitoring, when it comes to equipment, and obviously, as mentioned, when it comes to staffing. We've been also attempting to expand ventilator and high flow nasal cannula setups with additional rentals, additional purchases that we made back in the spring, some of which are showing up now. Talk about the lag time on purchasing ventilators. We bought ventilators in March that are supposed to show up next week, and it's only a few. So fortunately, the RAC has helped us in that regard in terms of expanding our capacity. And I also think the high flow nasal cannula therapy, some of which we can do outside of a traditional ICU and IMCU setting with some of those devices that come with compressed air, have really saved us in terms of otherwise not being able to manage some of these patients, period, just because of what they require. We also are dealing with things you wouldn't think of, such as I just got a message yesterday through our exec team that the way we're taxing the oxygen supply becomes a question. These are things that we don't think about normally because they're never problems we've had to address. But every day we have new situations come up like this that are causing us to have to look at other ways to really kind of crack the nut and make sure we're providing the best care for our patients and not putting people at unnecessary risk. Changing gears a little bit, quarantines. We have 171 employees quarantined as of today. Of the 171, 53 of those are nurses. That's part of the reason why the RAC staffing is so essential in terms of getting those individuals who we're very appreciative of coming up to our region and providing that additional care. I got off a call this morning with our additional chief medical officers across the division for our entire Ardent Health system, which has hospitals, 30 hospitals across our country. And I'm helping those folks, and we've been collaborating on developing protocols that are working with CDC guidelines, but looking at how we can be more aggressive with bringing people back to work sooner with testing strategies that are going to allow us to have the adequate staff. This is pushing the envelope on our ability to manage patients because we won't have the healthcare providers to do so. So again, these are things that folks need to be aware of that we are addressing here on a daily basis. I'll echo what Dr. Weis said about elective procedures. We have already been restricting elective procedures for several weeks now. And that is that cases that really can be put off and pushed off, and our surgeons that are on the medical staff at BSA have been fantastic about that. And some of our non-surgeons that are proceduralists in different specialties, they've been fantastic about helping us say, yes, this can or can't wait, so that we're not putting patients at risk, and also that we're not taxing hospital resources. We're also surge planning to look at other ways to use facilities outside the hospital, and what that would mean and how that would look. That is not ideal. And I'll just tell you right now, anytime we move outside the walls of the hospital, we are having a voltage drop, is what I would say, in terms of the quality that we can provide, whether it comes to the resources that are used for imaging, laboratory, et cetera. It's just putting an extra strain on how we get the most efficient care for those patients. And then I think the last couple things I want to say are our staff is taxed. From the ER staff, nurses, physicians that have been working at the tip of the spear and doing a fantastic job at BSA, to our ICU nurses, our med surg nurses, all of the folks, the physicians that are managing these patients, from our hospitalists, our intensivists, they are taxed. And it's at the point where we probably are going to need to look at a secondary avenue for bringing physicians in from outside, just like we're bringing nurses in from outside. And drawing on potentially some community resources for those providers. That's the point that we're at currently. And I can't stress that enough. We are expanding some abilities with testing, which is going to let us use a different platform for testing with antigen testing here as of next Monday. It's going to help us, but this huge demand on testing because of the inpatient rise and outpatient rise is dwindling some of our PCR reservoirs, and that is also becoming a challenge. So again, the more patients we have, the more we're not able to control this. These are the ramifications that occur when it comes to being able to manage the population. And then the last thing, again, I'll say is this is critical. We can all do a better job. I can do a better job when we're not in the workplace and out in the community. We can all do a better job of wearing our masks. I recently had driven down to a city south of us here, we all know well, in Fort Worth, Texas. I was highly impressed at the near 100% masking rate, it appeared to me, that was going on down there. I couldn't find anybody without a mask on. And we could do a better job here, is what I'll say. We're doing a good job, but we could do a better job. And again, it's about thinking about your partners and your family and other people's family. And young people can get very sick with this disease. We need not be fooled about that. I think that's enough, I'll say today. I appreciate the time on the call.
Thank you, Dr. Lamanteer. Let's now go to Dr. Rodney Gonzalez, Director of the Amarillo VA. Dr. Gonzalez, how are you today?
I'm doing well, thank you, Dave. First of all, let me just give a report on our COVID numbers here at the Amarillo VA. Presently, we have 15 COVID positive patients in our hospital, 7 of which are in the ICU. Much like the other staff talked about, we have gone to our surge plan. We have expanded our bed size from what it normally is. We have had to move staff around who are trained, but typically did not work in our inpatient area to have the adequate staff to take care of an increased number of patients. One of the things that has done is it's caused us to have less staff available in the outpatient areas. And so we have had to adjust some of our availability in the outpatient clinics. And I do want to remind our veterans, if you do not need to come in for a face-to-face appointment, but have one booked, you can call us, let us know. We can do this virtually through telephone or video if that is possible. Last week, I had the opportunity to talk to nearly 3,000 veterans in the Panhandle area through a telephone town hall about what our Amarillo VA is doing in response to COVID. While I got to hear a lot of great things that they appreciate about our VA, I also know that they, much like many of our staff, are tired of the COVID. But that being said, we continue to emphasize the same 3 items that I believe every panel member has emphasized: wearing your mask, good hand hygiene, and social distancing. And then I always like to add that, and I believe Dr. Weis or Dr. Milton had also mentioned, get your influenza vaccine. Get your vaccination done if you have not already. One of the things I also want to tell our veterans, we do have the ability to do asymptomatic testing at all of our sites: Amarillo, Childress, Clovis, Dalhart, and Lubbock. So for those veterans who would like to get asymptomatic testing, they can call our standard number, 806-355-9703. Press option 2 will connect you with somebody who can talk to you and give you an appointment time and let you know where that location is. Those tests are not done on our facility, but we will let you know where those are able to be done. Last thing I want to say is, as you know, I always like to end with some thank yous and some acknowledgments. I do want to thank our staff. They are doing amazing jobs. But as a military service member or a prior military service member, this month is National Military Family Appreciation Month. And, one thing I want to give a shout out to all those families of the veterans, the ones who support the veteran while they're doing the things. I've deployed multiple times. I've done many jobs. I've spent long hours at work. And I always say, I think my wife has the tougher job. Mm-hmm. And so I just want to acknowledge all those military family members and what they do, and our veteran family members. And once again, thank you to the City of Amarillo for this opportunity. Thank you, Dave.
Thank you, Dr. Gonzalez. Now we're going to go to City Manager Jared Miller. Mr. Miller, how are you today?
Doing well. Amen, Dr. Gonzalez, on the spouse having the hardest job when the service member is deployed. I want to remind everyone that the drive-through testing center remains open. If you feel like you have symptoms that are consistent with coronavirus, call 378-6300. You'll be screened for the drive-through testing center. I want to commend all the people working, all the public health employees working at the drive-through testing center. We are doing more tests daily now than we have at any point in the coronavirus, this coronavirus period. There are small lines there. They're moving very fast. It's not a reason not to go. If you feel like you have coronavirus, you need to go get tested, and the test will happen very quickly. But they're moving a lot of people through there, and I really appreciate all the hard work that they're doing, sometimes in very challenging weather conditions. I want to also remind everyone that if you need transportation assistance, that Amarillo City Transit is providing free transportation to anyone that's referred to the drive-through testing center and needs transport. Call ACT, Amarillo City Transit, at 378-3095, and they'll arrange the free transportation for you. Also want to remind everyone, consistent with what everyone has said on the call so far, that we are still under the Governor's Executive Order GA-29, which requires face coverings when out and about and when in certain situations. Just want to remind everyone the importance of following through on this and adhering to these face covering requirements. They are the easiest, the most simple, and the most effective way that we can reduce the spread of coronavirus in our area. And I'm making a medical statement, but I see all my doctors on the call nodding their heads on that. So we really need to take that serious. If for no other reason than to assist our public safety and public health professionals that are out there working in challenging conditions, trying to serve everyone, but not being able to get to everyone in the time that we want. Thank you, Chief Mays, for your words on that earlier. Very representative of our entire public safety community, not just the fire department, but also police, emergency communications, public health, and all the other people that are responding on the front lines, including our nurses and medical staff at the hospitals. Finally, we're also under GA-32. GA-32, since we are an area of high hospitalization, is very straightforward. We have certain operations and functions that are allowed to operate at 100%, primarily essential services, and then also churches and youth camps and things like that. As an area of high hospitalization, everything else is at 50% now. And the only major deviation from that is that bars are directed to be closed since we are an area of high hospitalization. The city is taking steps to reduce face-to-face contact in city facilities and at city locations. This is not a shutdown of any kind for any private or other jurisdictional facilities. This only affects city facilities. We are consistent with the governor's order in doing this, but we are working to make sure that we are setting an example for reducing our face-to-face interactions, given the challenging situations. That's very much an understatement, given the dire situations that our hospitals are dealing with right now. Setting the example and emphasizing the importance of reducing our face-to-face interactions. When we do have to have those face-to-face interactions, we're militant about wearing our masks, maintaining social distancing, the sanitation measures that are necessary to keep our workspaces safe. We also want to minimize those face-to-face interactions so that we can reduce the need for citizens or for employees to have to expose themselves to travel and other interactions that can transmit coronavirus. So this is going to impact some of our citizens who need to pay utility bills or go to the library, go to the parks, things like that. Parks are still open, but the park facilities are going to be closed. That starts today and will be fully implemented by the end of November. I can answer any questions you have, Dave, or any questions that the press has specific to how our specific facilities are affected. But we will be communicating that out to everyone that calls these different departments for assistance.
Thank you, Jared. Let's now go to our media members who are in attendance. If you have a question for an individual panel member or the panel as a whole, that's completely fine. Let's go ahead and start with, if I'm not mistaken, Kevin Welch of KFDA Channel 10. Kevin, how are you today?
Thank you. Can Dr. Weis and Dr. Lamanteer talk a little bit about the length of time patients are staying in the hospital? Is there a trend to that? Is it getting shorter, longer?
I can start. So give me a great question. So there is no doubt that overall COVID patients stay longer in the hospital than someone who does not have COVID, who might also have the same comorbidities. But in truth is we have had several patients exceed 30 days in our ICU on the ventilator. So we are seeing some people get extremely ill and stay in the ICU for over a month while we try to get their lungs back to some kind of shape to come off the ventilator. But overall, if someone goes to our ICU, on average, they're staying typically at least 5 to 7 days in the ICU and then spending several days on the med-surg floor after that. So yeah, we are definitely seeing prolonged stays with this virus.
Yeah, and I would agree that there's no question that these patients that come in with COVID stay longer, period. If you have an equivalent respiratory illness with a different infectious agent, you compare length of stay for the cohort, and length of stay is longer on COVID patients. That doesn't mean some don't get discharged in a short period of time. Some are, but not the majority, especially those that require critical care, like Dr. Weis mentioned.
Okay, same two doctors again. You said that one cause of the nurse shortage has been the need to quarantine, but have you also seen nurses leaving the profession or going to a different facility because of the stress?
I'm sorry. So the answer again is yes. We have lost a number of our own nurses. Part of it is for a number of reasons. It could be just the stress and fatigue. We have had some nurses that feel kind of a commitment to travel to other areas to take care of high acuity places. So we've lost a number of nurses to some of this traveling that they're doing. It just as we bring in travelers, so it's kind of like we're almost stealing one from the other in terms of nursing staff. So yes, we've lost a number of our own nurses who have been here for a while for different reasons.
Yeah, and I would agree that there have been some nurses that we have lost that are not because of quarantine, but that's the minority. I mean, the individuals that we're getting taken out of the workforce are those that are quarantined because either of infection themselves or exposure. Most of those are exposures and not infections. But our nursing crews are tough. I mean, nurses are tough. And they want to work. And, when we're telling them they're quarantined, a lot of times they're frustrated. Yes, they're tired. And yes, they are abiding by the proper guidelines for quarantining. But when they can come back, they want to come back and help their comrades.
To deal with that stress that all the staff, I guess, is feeling, do y'all have any special programs, or is it a kind of a case-by-case basis to help them deal with it?
So Kevin, that's a great question because that's critical. we just added another a member to our pastoral care department. We are working on what's called a second victims team. A second victim is considered a healthcare provider who in some way suffers from caring for a patient, whether it be from the trauma of the event or stuff. So we're starting the second victims team to help support our staff. Of course, we always have the standard counseling services available that we have for any time that any of our staff need this. But yeah, your point is excellent. We are having to really focus on our staff because they are in as much as need as I've ever seen them for a lot of what Dr. Lamanteer suggested, which they're tough, but they're wearing out, and we need to support them.
Agree. We have similar services that are available, and they are critical in terms of trying to support folks as much as we can with the resources that we have available. There have been folks that have come to us as counselors in the community offering their services. So we have a number of different avenues to help support nurses and other staff, not just nurses, but all staff that are taking care of patients and trying to cope with some of the mental stressors of doing so.
Okay, Casie, is there any special reason why the new cases were up so sharply on Monday and Tuesday?
Yes, so we have lots and lots of community spread and lots of positives reported to us. We did over the weekend, our teams worked to complete some data entry from last week. But like we've seen this weekend, when the numbers come out today, we're consistently just seeing lots and lots of new cases.
Okay. Now the DSHS website, one of their dashboards says that our trauma service area has 6 available ICU beds. First of all, do you think that's true? And if so, are they in Amarillo or are they in the region? Dr. Weis, I guess.
Well, I would just say, Kevin, we are typically down to no more than single-digit ICU beds available at any given time, and so yeah, that's part of the challenge. Because we're a trauma center, we do have to maintain 1 or more ICU beds available at all times for trauma patients. But yeah, we don't get much above just a handful of beds available at any given time, and they fill pretty quickly every day.
Dr.
Yeah,
Lamanteer?
Agree. I mean, that's a static. I wouldn't doubt at all that at a static moment in time, we may have had 6 beds available, and then a couple hours later that changes. We may have had 2 beds available, or we may have opened up to 10 beds available. But again, every morning when we're looking at our census at the early morning hours, the majority of our ICU beds are occupied. The majority of our intermediate care beds are occupied. And if we had not expanded ICU bed capacity, we would have no room for these patients. So remember, both hospitals have expanded ICU capacity significantly.
Okay. And Jarrett, can you explain a little bit about how you're going to control access to facilities in parks?
Parks are still going to be open for use by citizens if they want to go and exercise and just enjoy the open spaces. However, we are not doing league plays. We're closing down fields and things like that for leagues, tournaments, things like that. We're closing down certain gazebos and pavilions and other things that people can rent or reserve because the purpose of those reservations is for gatherings. So the parks are accessible and people can still use them, but there are certain aspects and programming that is not open. We're not having our classes. We're not bringing people in for different programs and trainings. So those things are turned off, but the parks themselves are still available for use by families, by individuals, things like that.
Okay, thank you all. That's it.
Thank you, Kevin. Let's now go to Dalton Williams, KVI Channel 7. Dalton, how are you today?
I'm good. How are you?
Very good, thank you.
So my first question is to the doctors on the panel. With the hospitalization rates increasing, what are some of the contingency plans if this continues to get as bad as we fear?
I can start there. I can start there. We had a discussion with the RAC Monday. Dr. Milton was on the call as well. And essentially, we're looking at ways to have some of our regional partners help us. And we're doing that now, where we're trying to get folks discharged to those facilities that can handle a lower acuity patient, which means that these patients typically would not be sent to those facilities necessarily this early, but they're lower acuity and we need the beds for sicker patients. So our regional partners are willing to help us in that regard. And we're trying to arrange some of that transportation today for folks. So we're very happy that our regional partners have been willing to step up and help us. That's one method for us to decompress the hospitals that I think is significant.
Yeah, I just want to point out, I think I like the way Dr. Lamanteer said it, which is you see a voltage drop when you're taking care of patients outside the walls of the hospital. I think that is critical. We talk about that all the time. The safest place for these patients is in the hospital. That's where we have all the ancillary services, the oxygen, the ICU. Yet, however, we are having to talk about moving patients to outside facilities, all the way to even consideration of using tents to take care of patients. That is not ideal by any stretch. And that's a challenge, is how can BSA and Northwest, along with maybe some of the regional skilled nursing units or LTACs, take care of these patients in a hospital setting, a proper hospital setting, because that's ideal. And the minute we start talking about these alternative care sites that you're seeing in other cities like El Paso, that opens up a whole bunch of issues that are difficult to address. And by no means will those patients get the care they would inside a dedicated hospital.
Yes, I don't have anything else further to add other than what Dr. Weis and Dr. Lamanteer mentioned.
Okay, and like you were saying, the most ideal place for those patients is an actual hospital bed. But if we did have to go to tents, like we weren't able to get them to our other partners, what would those tents look like? Would they be akin to a military MASH unit?
Well, of course, I've not ever exactly seen one other than looking at pictures, but the description the other day was that they would be a tent that would be in direct contact with the hospitals, kind of an extension of the hospitals, and so apparently would have the ability to be even to provide negative airflow and other things that would be important in taking care of patients with COVID. Obviously, there's a lot more to having to stand up something like this, because staffing is such a critical concern. And so I think that we just want to make sure that we're supporting our hospitals as much as we can to get them the resources they need. I think those things are available, and the discussions are ongoing. And I think they're standing ready if that's necessary.
Okay, and then my final question, Dr. Weis touched on this partially briefly in your statement about overreporting of COVID deaths, but there are some accusations that floating around that the reason that people are saying that COVID deaths are being overreported is because hospitals are gaining extra money if they are reported as COVID deaths. So just kind of how do y'all respond to those accusations?
Well, I'll start. If that's true, I missed that memo because we are not aware of how that is happening. And again, I mentioned it a week ago. Hospitals are paid in a different way. We get paid a lump sum of money based on the admitting diagnosis of a patient. So if you come in with pneumonia, your insurance or Medicare will pay us only a certain amount of money for taking care of you with pneumonia, and it's up to us to try to give you the resources you need with that amount of money. Admittedly, if you're diagnosed with COVID pneumonia, okay, the hospital gets a little more money, from the insurance companies or Medicare because it's now COVID pneumonia. But as Dr. Lamanteer and I mentioned, some of these patients, their length of stay is so long, it far exceeds the money that we're getting reimbursed for the resources we're having to use to take care of those patients. So I would say I am not aware of any mechanism where we might be gaining reimbursement because we code someone for having died from COVID. It's actually the opposite. We get the lump sum of money, and it's up to us to try to give them all the resources we can within that money that we're given to by a funding.
Okay, thank you all so much. That's the questions I have. Thank you for having me.
Thank you, Dalton. Let's now go to David Gay of the Amarillo Globe News. David, how are you today?
I'm good. Good morning, everybody. I guess my first question, I know there's been a lot of talk about possible extensions of wards and outside the hospital. Have either Northwest or BSA have you guys sent any COVID patients to other metropolitan areas in the state, Dallas, Houston, places with more hospital capacity than in Amarillo?
I can start that. No, we have not. We have not had to send any patients out to other acute care hospitals or tertiary care centers because of our numbers. Doesn't mean it couldn't get there, that we're trying to avoid that at all costs, but we have not had to send anybody out like that.
And David, I respond the same thing. We have not sent anyone out. Now, as we've mentioned in the past, we have had to decline requests for patients coming from regional facilities from some of these smaller communities, and they are likely having to send their patients elsewhere because we cannot accept them. So they may be sending them to Dallas and some of the other larger areas, but not from Northwest or BSA in particular.
Absolutely. And I guess, is there a certain threshold or anything that it would take for the hospitals to start considering that measure?
I'm sorry.
I don't think there's a. Go ahead, Brian. Sorry.
Well, I just say, I don't know if we have a particular threshold. There's a lot of considerations to that because transporting these patients is a real challenge. Most of them are very sick, and you're talking about airplanes, helicopters, whatever. Most of the airplanes get to Dallas, stuff like that. So it's a big deal. Again, we are going to try to use every square inch of this hospital until we have nothing left. And I know BSA is doing the same thing because we know the patients are safest when they're in a facility like this.
Agree. That's a very last resort situation that we are trying to avoid at all costs.
Absolutely. Absolutely. And I guess a clarification for Mr. Miller. So with the city doing limiting face-to-face interactions, is there any other does that extend from the city to other businesses, to other places in the city, or does that just remain a city policy for city services?
No, it does not extend to any business or jurisdiction outside our facilities that are City of Amarillo facilities. So we are only talking about service modifications and alternative service delivery plan that only affects City of Amarillo, the organization City of Amarillo, buildings and facilities.
And just a clarification from my personal notes, that order to, I guess, extend it from City of Amarillo services, that would have to be a state mandate from the governor, correct?
Correct. And I apologize for my phone, but the governor's executive order GA32 is very explicit that we are not authorized to do more or less than what the order stipulates. So we're not authorized to do any closures, and we're not asking the governor to do that. We are taking steps with the facilities that we are responsible for to make sure that our citizens and our employees are as safe as they can possibly be while still being able to conduct business.
David, I want to chime in on this. I'm really glad you asked the question. A lot of citizens are asking me this question, and I'm very proud of the leadership that we have at the city. I think the city is setting a great example as a business in the city of what needs to be done in order to operate your business that keeps your employees safe, but also keeps your customers safe. And so I would appeal to every business owner in the city that we would make the respectful choice. We would make the responsible choice. And we would not ask the governor to impose some limitation on us when we can ourselves better govern our problems here locally by the choices that we're making. So if you own a business, I'm asking you, please have your employees wear a mask all the time while they're at work, and have a plan for how they're going to take breaks together or how they're going to do lunch together, because those are the small times when they're not wearing their masks. Boom, we're getting exposures, and then you're out a whole group of employees. And I would ask that you ask your customers and enforce on your customers to wear a mask when they come into your place of business. So those are the things that I'm asking the city to do. I can tell that it would make a difference in our hospitals. And I'm not asking the governor to come in and act as a police officer for us. We want to govern ourselves, and we can do that best by making our own choices respectfully and responsibly.
Absolutely. Thank you, Mayor. Thank you, Mr. Miller. Thank you, everybody. That's all the questions I have. Have a great rest of your week.
Thank you, David. Let's now go to Aaron Langston at KAMR Channel 4. Aaron, how are you?
Pretty good. How are you?
I'm good, thanks.
Question number one. We know that a AISD kindergarten student passed away recently because of COVID. Do we know who is handling reporting of cases like that and other similar cases?
That type of reporting would come through the public health department. And, you know, we're heartbroken and stand just heartbroken, and our thoughts and prayers go out to this particular family and any family who has lost someone here in our community. We know that this disease has taken a toll on our community, on our state, on our world, and on anyone who has lost someone. So we're certainly heartbroken.
Alrighty. Last week it was reported that Amarillo ISD has the highest number of COVID cases reported of any school district in the state. Is there a reason we're seeing that and some of these larger school districts are not?
I think one of the functions of that is there's many school districts across Texas who haven't gone back in person. And AISD was one of the first districts to go back in person. And so we've had time here in our community to have those exposures and have those case counts rise. I think as time moves on, as the larger communities, their districts are going back in person now. I think that they will have additional cases. I think that by percentage, our case counts are probably not the highest. By number, they may be, but we certainly are working with the districts, and we appreciate those measures that AISD has put into place to keep their kids and their teachers safe.
Okay. Are we seeing a lack of the rapid test here locally?
I don't believe so. We have those reported to us daily. So I think the hospitals can certainly talk about their capacity, but we see those reported to us daily.
Yeah. Aaron, I'd say at Northwest, we're probably in the best shape we've been in with regard to having really 2 different PCR tests available, as well as antigen testing. So yeah, actually, so far we're doing very well in terms of being able to turn these tests around, oftentimes within 15 minutes to an hour or so.
Yes,
Okay.
and same at BSA. I mean, we have adequate rapid testing capabilities. We're adding the antigen platform. We've already gone through validation with our new platform, and that'll start formally on Monday. Just that the burn rate on these tests is higher, obviously, because of all the patients we have and the exposures that we have, or people at risk, I should say, plus the outpatient community taxing those testing capabilities for folks not coming to the hospital for admission. So again, the burn rate's higher, but we do have ample tests, and the rapid nature of turning these around is critical for us to manage our inpatient population.
Alrighty. And are we seeing a large number of false negatives from some of these tests? And if so, how is that contributing to the community spread situation?
We're not seeing a significant number of false negatives at BSA. And again, I think part of the key is not testing individuals who are asymptomatic, which I think Dr. Milton has expressed for months now in terms of, number one, why the city protocol is set up the way it's set up and what we've tried to do at the hospitals. And that is that the false negative piece comes into play when we start testing more people that are asymptomatic in terms of that risk being a bit higher.
Yeah. And I would say one thing is what we noticed. So this antigen test that we've talked about, that's the fastest one. That's 15-minute turnaround time. That's the one that checks for proteins of the virus. That one we're probably seeing about 85 to 90% sensitivity, meaning that 10 to 15% of cases we're getting a false negative. Now, what our staff has learned to do is if there's still a high clinical suspicion that patient has COVID because of their X-ray or something like that, then we turn around and do a PCR test. And the PCR tests have proven to be incredibly accurate. So we're using the antigen because we have a lot of those. It's a fast test. We're using that for initial screening in a lot of situations, but that is the one where we would anticipate false negatives, and we do follow it up with a PCR if there's a high suspicion.
And Aaron, I think it's important for people to know that if you're sick, you need to stay home, regardless of what your test says. If you're symptomatic, if you have cough and shortness of breath and fever and the sniffles, even if you think it might be allergies, you need to stay home just in case. All of those pieces together, we don't want to spread COVID, and so it's important to stay home.
Okay. And one last question. Does anybody on the panel feel that AISD should go virtual because of their high number of positives within the district?
I think there's a lot of moving pieces to that question. And so, we work with the school districts daily. And so I think that's that's certainly a tough question to ask, especially in this format. And so there's a lot of moving pieces with that, and we support them in their decisions and we want people to have an opportunity to make those choices, but we also know that there's a lot of moving pieces in that question.
And I would add that, the best leadership always applies the most narrow solution for the biggest impact. And so in this case, shutting down our schools would not be a narrow solution. That would be a very broad approach. What we have in front of us, though, is a more narrow solution. Going to birthday parties, having large family gatherings, people doing happy hours, quinceañeras. I mean, these are all things around our city that I'm seeing pictures on Facebook, and people are inviting me to come to these things, and we're not wearing masks. So I would say a much better solution for us as a city. It costs us so much less. It's so costly to our children to not have school. I can't even begin to list off all the things: mental health, social, all of the learning that they lose if they're not at school. If we will wear masks and we will personally choose to limit the social gatherings we go to, I do not believe we will need to ask our kids to stop going to school in person.
Also wanted to piggyback on what the mayor said. We understand, and anybody that has kids in school understands that it appears they're doing a good job of wearing masks at school. Our current condition locally in this trauma service area and in our 2-county health district would indicate that we're not wearing our masks when we don't have to wear our mask. When no one's making us wear a mask, we're not wearing a mask. And I think the schools are doing a good job of requiring students to wear their masks when they're in that educational environment. When the students go to lunch, when they go home, when they go away with other friends and do other things, when they're with their families, when they're shopping, these are the times that we see people not wearing masks. It's logical to assume, it's anecdotal at best, but it's logical to assume that the growth and spread that we're seeing in our community as a whole is also going to be represented in the population of kids and teachers at school. So to what the mayor said, wearing our mask is the best way to address the challenges you're articulating. And I don't know that it's the best way. It appears to be the best way to fix the challenges that we're seeing both at the schools and at the hospitals and everywhere else in our trauma service area. So if we would be very diligent about wearing our masks and learn some of the lessons that we've seen from these very high population areas like Houston, San Antonio, Austin, really big cities that you would think would have a much higher percentage of transmission because of the population density, the amount of large businesses and things like that, but they don't. They're seeing 3 and 4% hospitalization rates according to the governor's metric, and we're seeing over 31% here. We need to wear our masks. It'll make a difference.
Alrighty, I think that has me covered. Thank you very much.
Thank you, Aaron. That now concludes today's news conference for the Amarillo community for the latest in COVID-19 information. I want to thank our panel members who took the time out to join us today to provide this information to the community. Once again, we do these every Wednesday at 11 a.m. This is David Henry. I'm the Communications Manager for the City of Amarillo.